Hi, my name is Sheila Alexander, and I've been a licensed massage therapist since 1993. In 2002, I made a life change to home care my father with Alzheimer's, then provided care for my mother's terminal cancer. In 2004, I was hired to build a massage and spa practice in a continuing care retirement community in Davidson, North Carolina. This was for their residents in all levels of care. Before I went to massage school, I did massage as a hobby. So if you enjoy giving massage to your family and loved ones, this online class gives you proper guidance. We all have seniors in our families and in our communities. They're our most precious resource. If you are a massage therapist and want to learn new techniques to work with seniors, order the introductory online class. And for the complete 16-hour Senior Spa 1 and 2 nationally approved continuing education class, please visit my website seniorspa.net or contact me to schedule a class for your group. Now, I take pride in being a baby boomer, one of those born between 1946 and 1964, the largest generation in U.S. history. As Roger Daltrey of the Who rock group sang in the song My Generation, "Hope I Die Before I Get Old," baby boomers expect excellence in services and quality of life. Businesses such as McDonald's and CVS stores are widening their aisles and entrances, lowering their shelves to make allowances for seniors' ease of shopping. Baby boomers are being referred to by retailers as the silver tsunami. The Council on Aging has resources for every state in the country, and one thing that they provide is the Bill of Rights for nursing home residents. These are available through the North Carolina Department of Health and Human Services, Division of Aging, if you wanted to look up a complete page on the rights. As part of a caregiver, you as a caregiver are to know what their rights are, and they are protected by law. They're part of the foundation on which quality resident care is built. These seem like they should be common sense, but sometimes common sense is not so common. So in everyday care, protecting residents' rights means treating every resident as an individual, giving residents as much choice and independence as possible, never talking in the presence of a resident if she were not there, never treating a resident in a harsh, angry, or hurtful way, never repeating things about a resident except as an appropriate part of giving care, and also managing personal and workflow stresses so they never interfere with respectful care. Another right to include is the right to decline services or therapies. The resident has a right to decline meals, medications, activities, physical therapy, occupational therapy, massage therapy, visits with family. This is one of their rights. So if someone tells you that they don't want a massage when you come to see them, you never try to talk them into it. You respect their right to decline, and you just reschedule for whatever reason. In recent years, the nursing profession used technology and pharmacology to relieve conditions such as pain, anxiety, and insomnia that were once treated with massage. However, interest in massage has grown with the move to more holistic nursing. The most common protocols for this study were 3-minute slow stroke back massage and 10-minute hand massage. Physiological and psychological indicators suggest the effectiveness of slow stroke back massage and hand massage in promoting relaxation in older people across all settings. So regardless of why seniors may consider massage, they will only benefit by being touched. Unfortunately, many seniors view massage as a luxury and they don't consider it a form of therapy. So specific training in massage for seniors is necessary to access this population. The appropriate modality is based on the therapist taking a good medical history as well as a physical and emotional assessment. Some seniors seek massage therapy for relaxation, whereas others come for relief from medical conditions. So massage can, we know, ease pain and discomfort brought on by sore muscles or years of pain from arthritic joints. By softening hardened musculature and releasing areas of holding, massage encourages a better exchange for absorption of nutrients. It also promotes restful sleep and relieves insomnia, helping to release endorphins, natural hormones that reduce pain as well as provide a greater sense of well-being. Can speed recovery from surgery and increase mobility and range of motion. Massage enhances the effects of physical therapy, and many seniors report incredible rates of recovery from joint replacements. And of course, it improves all body systems affected by the aging process. But most importantly, massage feels good and can reconnect seniors to their bodies, minds, and emotions during a time when they may be at risk at being overwhelmed by physical pain and or psychological loss. So keep in mind that even if massage therapy is contraindicated, engaging in simple, respectful touch can be a great source of comfort. Light stroking can be as effective for many seniors than a deeper massage. Knowing the contraindications for performing or recommending massage is critical for the senior population. If there are doubts as to the appropriateness of massage, a physician or other healthcare practitioner should be consulted. This exchange of information is an incredible opportunity to educate the medical community and for massage therapists to learn how to integrate their skills into the healthcare setting. So some situations that contraindicate massage therapy are: do not massage any area that looks inflamed, blistered, or has a rash. Don't attempt to move any joint past its resistance. No open sores or wounds, a client with a fever. No areas that feel hot, possibly indicating an inflammation or an acute arthritic condition. No calves with deep pressure, as these areas can be sites of thrombosis or blood clots. No varicose veins. Areas surrounding the veins can be touched with gentle holding though. Don't use deep pressure on the cervicals, as these may be compromised circulation in the carotid artery or the presence of osteoarthritis. Don't use strong traction or rocking motions without proper assessment. Gentle traction and gentle rocking motions may be used and often feel good, but strong rocking of the feet is not advised and can increase strain on the knees, hips, and vertebral joints already damaged or unstable. Don't massage anyone who appears to be acutely ill, displaying such signs as profuse perspiration, confusion, labored breathing, unfocused eyes, or anyone who is not responsive. Do not palpate with direct pressure. Use your flattened fingers instead. So the definition of geriatric, it refers to health changes that occur in the body due to the aging process. Just like pediatric refers to developmental issues and developmental processes while the baby is growing, geriatric refers to decline. And the three classes of seniors are healthy, active, age-related, and fragile. So here's Betty White, and she is the poster child for a healthy, active senior. So the healthy, active senior is the model of healthy aging. They may be in an independent living center or live by themselves. There are no time limits for a massage session, as they can receive 20, 40, or 60-minute sessions depending on their need, desire, and tolerance. For age-related seniors, they have the ability to complete what we call ADL, or activities of daily living, such as bathing, dressing, and grooming with minor help. They can feed themselves, be oriented to person and place, be continent of bowel, bladder, or self-manage incontinence. They can be cognitively intact or display confusion with the ability to be redirected. So this class of senior needs support in ambulation, which getting around. They need either a cane, a walker, or a wheelchair. They may need help with meal preparation, medication, and treatment administration. So the recommended session time for this senior is 20 to 40 minutes, depending on their need, desire, and tolerance. The third class is fragile, and most of these folks are in skilled nursing, and this individual is in a visibly deteriorating state of health. Many of these people have suffered illnesses, accidents, and chronic diseases such as heart disease, cancer, stroke, dementia, Alzheimer's, and or Parkinson's. And they really need help and support with everything, with their ADL, with feeding themselves, their bowel bladder incontinence, ambulation, transportation, transfers, wound care, and sometimes they will wander. So the recommended session time for this senior is 20 to 40 minutes, depending on their need, desire, and tolerance. Now the next slides I have are pictures of what are called rollators. And you see these folks, maybe you're even on one yourself, or you have someone in your family. You see them in the grocery store, and they have brakes on the handles. There's a little basket, and then there's also a little seat. So these can be lowered or raised depending on the person's height, and that's always done by a physical therapist. But the next slide I have is a super duper new rollator for the baby boomers of my age, because we want something high tech. So the next slide is the newest, latest, and greatest, and I put that up there for you all to see. I'm going to recommend Ruth Werner's book, A Massage Therapist's Guide to Pathology, that is just totally complete for all of the conditions that you may encounter with seniors, and there are many precautions to take. But I'll go over a few for non-therapists that are, and I'll try to keep it simple but complete. So with skin allergies, I always ask if they're sensitive to any skincare products, and I keep cream, and I also keep grapeseed oil on hand. But the grapeseed oil, I don't like to use oil because I think it just makes a mess. I have a cream that I use that, and a lot of the drugstore creams, Jergens, CeraVe, Lubriderm, I think you can just use some products just from the drugstore that will just be fine. With arthritis, anything that has itis on the end of it means inflammation. So of course that's inflammation of a joint, usually accompanied by pain and swelling. Moist heat and gentle massage help to relieve if chronic. I do not treat during a flare-up, and no manual traction should be used. Depression is a kind of a global problem, and it is a psychiatric disorder with symptoms such as persistent feelings of hopelessness, fatigue, sleep disturbances, poor concentration, or suicidal thoughts. Research shows favorable treatment options include drug therapy, talk therapy, exercise, and massage. If you have someone that checks that on their intake form, or they tell you that they suffer with depression, don't offer any advice or your own experiences. So the main thing to remember when you are working with someone that suffers from depression and they've confided in you that they suffer from depression, you're a licensed massage therapist. You are not a psychotherapist. So it is not your job to diagnose or treat them or cure them from depression. It is your job to listen to them, to try to help them and be a sounding board because they've confided this in you. And it is also your job, if they ask if you could help them through a situation, you need to refer them out to a licensed psychotherapist or mental health professional. Part of our job as massage therapists is to listen to people. And when I say you become a sounding board, you become a safe place for people to share struggles, stories, experiences, but you become just an ear to listen to them, not to treat them. Another condition that is very widespread these days, you hear, is fibromyalgia. Fibromyalgia is an autoimmune disorder in which the body's immune system is attacking itself. It is very hard to diagnose, and it is a disorder that causes aching muscles, sleep disorders, and fatigue associated with raised levels of the brain chemicals that transmit nerve signals or neurotransmitters. These patients suffer from a host of symptoms, particularly sleep deprivation. My seniors report relief from extremely gentle work such as acupressure or just gentle touch. Well, acupressure just means finger pressure. It is a very gentle type of therapy that works with the meridians and the channels, the energy channels in the body, and that requires an extra class to learn those patterns. But the acupressure is something that you can even do for yourself, for self-care. There is a point between the thumb and the forefinger that if you go between those two bones and just put a gentle pressure with your thumb, you can feel a little pulse there. Little pulses are felt all over the body. It is the energy that runs through the body, also known as qi, the universal energy that is studied in the Chinese philosophy of yin and yang. Acupressure is very helpful with fibromyalgia because fibromyalgia patients, no two are the same. There is muscle and joint pain with almost every case, but you need to take a really good medical history in order to know where they're suffering and know what meridians to work that will help to balance that part of the body that is causing them pain and discomfort. Many people assume that seniors are hard of hearing, and this is most annoying when the person can hear just fine. During your intake, ask if they wear hearing aids. The newer models are almost invisible. If they wear an older model and their hair covers them, The devices will emit a high-pitched sound when your hands are close to their ears, and you do not want this to happen. All right, so many people assume that seniors are hard of hearing, and this is most annoying when they can hear just fine. So the last year that my mother was alive, I took her to many of her medical appointments, and we would be in the room waiting for the doctor to come in, and the medical assistant would come in to take her vitals, and the medical assistant would look at her and say, "Well, hi, Miss Alexander, how are you today?" And my mother would look at her real sweetly and say, "Well, I'm fine, and I hear just fine too." She was the quintessential Southern lady. Many seniors wear hearing aids these days. The newer models are almost invisible. The older models can either be worn directly on the ear, or sometimes they're on the glasses. Always on their intake form, I ask if they wear hearing aids. And if they do, I always give them the option of whether to leave them in during the massage or to take them out. If they choose to leave them in, be very mindful when they're on the massage table, when working around their neck, because if you put your hands close to them, they will emit a high-pitched sound, and you do not want that to happen. If they opt to take them out, I always have a little dish there on the table where they put their watch and their glasses. So they put them in the little dish. If they take them out, make sure that you speak directly to them where they can see your face, and you also speak slower to make sure they can understand you during the massage. So the reason that I'm telling you about the hearing aids is that I had an experience where I had a lady that was on the table, and she wore a wig, and she had hearing aids on as well. She didn't want to take her wig off, and I did not know the hearing aids were underneath the wig, and she was on her back on the massage table. And when I put my hands underneath her neck to do some finishing work on her neck, my hands went over her ears, and it started emitting this high-pitched sound, and she started shaking like that, and I didn't know what it was, and I thought she was having a stroke, and she said, "Stop, stop, stop." So I put my hands down immediately, and she reached up and she took her hearing aids out, and I said, "Oh my goodness, I'm so sorry. I didn't realize that you had hearing aids in. So let me save you some trouble, and don't let this happen to you." So neuropathy is a disease or illness of the nervous system or to a nerve, and it usually occurs in the arms, hands, legs, and feet, and can be caused by either trauma or pressure, such as leaning on a crutch, repetitive motion, such as typing or overuse on a keyboard, poisons in the body from chemicals such as chemotherapy, a complication of diabetes, or it could be idiopathic, which means they don't know what causes it. So foot and hand reflexology is the best remedy that I have used. If you provide hand and foot reflexology charts to explain what you are doing and why, seniors are fascinated in this approach. There are also many types of arthritis. There's rheumatoid arthritis, which is a chronic inflammatory disorder that typically affects the small joints in the hands and feet, and it affects the lining of the joints that results in bone erosion and joint deformity. And it's more common in women, usually begins after age 40. Osteoarthritis is a form of arthritis characterized by gradual loss of cartilage in the joints, usually affecting people after middle age, shoulders, hips, and knees. For arthritis, most people with arthritis love moist heat. And so I would offer moist heat and just gentle strokes. And I won't tell you how old I am, but I am a senior and I have had a total hip replacement. I had that 5 years ago, and my orthopedist told me that I'm also looking at a knee replacement in my other leg. And he said, just wait until you can't stand the pain any longer, Sheila, and then we'll do the surgery on that. But I wrote in my Christmas letter that year, you know you're getting older when your orthopedic surgeon has rock star status. A pacemaker or artificial pacemaker is not to be confused with the heart's natural pacemaker, is a medical device that uses electrical impulses delivered by electrodes contracting the heart's muscles to regulate the beating of the heart. And this device is a medical miracle, but you want to avoid touching the device itself or the surrounding tissue. The shingles virus and shingles shot or vaccine is highly advertised these days. So herpes zoster, commonly known as shingles or also as zona, is a viral disease characterized by a painful skin rash with blisters on one side of the body, often in a stripe. Once an episode of chickenpox has occurred and is resolved in youth and children, the virus isn't eliminated from the body, but can go on to cause shingles, an illness with very different symptoms, often many years after the viral infection. A shingles vaccine is now available and recommended for seniors. Massage is not advised and is contraindicated. It is very contagious. You cannot give or receive massage if you have shingles. I have one lady that I've worked with for several years. She was in independent living. Now she's moved into the assisted living wing. I work on her right in her hospital bed. She can follow directions, and so when I go in to do her massage, she'll sit up in her bed and I'll ask her to disrobe, and I'll help hold something up in front of her with modesty, and then she'll lie on one side. After I finish working on one side of her body, she'll sit up and then she'll lie on the other side so I can work both sides of her back. So when I turned her over on her other side, and saw that rash, I knew not to touch her. Hit the call button to alert the charge nurse immediately, and then just waited until the charge nurse got there to let her assess the situation. And at that point, the charge nurse said, Sheila, I want you to stop. This lady has shingles and we need to get her some treatment. So I just stopped what I was doing. I covered her up. I went and washed my hands, and I did not see her for any more sessions until after she had finished her round of antibiotics, and the medical staff said that it was appropriate for her to receive massage again. Body mechanics and massage are very important. When I first went to massage school, people would ask me when I got out, my goodness, you do massage all day? How can you do that? Don't your hands and arms get tired? Well, one thing that I learned is that massage therapists use the big muscles in their legs. Yes, if you did this all day, I would get tired very easy and I wouldn't still be working. But this is what massage is. You use the large muscles in your legs to do the work, and then your hands just follow. So for those of you who have done yoga, this is a modified warrior pose. My back foot is facing forward. My front foot is at a 45-degree angle. So that's where my center of gravity is. So the large muscles in my legs are doing the work. So this is a modified warrior pose, and this is the first of the 3 stances that I'm going to demonstrate. This is warrior. The next pose is a modified horse pose. My feet are about hip distance apart. My knees are soft, and this way I can shift my weight in a circle and move my body this way to do the work instead of working my arms. So whenever I'm demonstrating this in class, in order to remind my students to pay attention to the horse pose, I'll say, now soften your knees. The third pose or stance I want to demonstrate, I called seated core. So as I'm working, I'm moving from my core. I'm not sitting back and working my arms. I'm sitting forward in the chair. My feet are flat on the floor. My legs are at a 45-degree angle, parallel to the floor, and then I'm going to move from my core to do the work. So I call this seated core. Move from your core. Now I'm going to demonstrate how to give someone a massage that's in a wheelchair. The first thing to be mindful of when you're working with someone in a wheelchair, the first thing is to lock the wheels so the chair does not move. This way it's stable and safe. I would like to mention a point of etiquette with working with someone that's in a wheelchair. Never touch or lean on someone's wheelchair unless you have been given permission. Their wheelchair is considered part of their body, and you are infringing on their person if you do. So this is my friend Sigrid, and we met about 7 years ago at the Y. She can do classes that I can't do. She's also in my walking group, and we call her our Jane Fonda. And she is the model of healthy aging. So at this point, I'm going to get her all set up. I'm going to put some moist heat on her neck, and then I'm also going to put a pillow down. But I wanted to ask her a few questions first. Sigrid, do you have any trouble with diabetes?
No.
Do you have any rashes or burns on your body now?
No.
Any open sores or wounds on your shoulders?
No.
Any high blood pressure?
No.
Okay. Many people are on blood thinners for a variety of reasons, and one of the side effects is that the skin is more easily bruised. You need to use lighter pressure and make sure that you check in with them about the level of your pressure. So because Sigrid doesn't have any precautions that we need to be careful of, then she's a really good candidate for massage. So I'm going to get some moist heat on her and also get a pillow on her lap. Most seniors love moist heat. And so I have just a neck and shoulder wrap. You can get these at the drugstore, of course on Amazon, everywhere now. So I have this that I just took it out of the microwave. It doesn't have a removable cover, so I'm going to slide this in a pillowcase to keep it clean. And then I'm going to walk around and just put this on Sigrid's neck and shoulders. I have just a regular bed pillow that I'm going to put in Sigrid's lap. This will create a barrier, a boundary for her, but it will also be softer for her arms to rest on. If you're doing this in someone's home, I always bring an extra pillowcase and put it on top so that I don't get any cream on their linens. So and after my hands are clean, I'm going to just take her hands down here to start. Now, we all know the benefits of breath and how we can calm ourselves down, slow our heart rate, and help to center ourselves with our breath. So I'm going to ask Sigrid to take 3 deep breaths in and out. Great. Now, Sigrid, if at any time you're uncomfortable for any reason, please let me know. And if I come to a spot that feels really good and you'd like me to stay there longer, then let me know that too.
Okay.
If you're working with someone that this is their very first massage, I always say, if there are any questions you want to ask me, then please feel free. And if you just want to be quiet and receive, then that's fine too. This is your time. So most seniors will wear something long sleeved. And so I'm just going to, and you can do massage either through the clothing or on bare skin. If she wants me just to not put any cream on her arms and just keep her jacket or a long sleeve shirt on, then that's fine. You can modify your strokes. But I'm going to show on her right hand, I'm going to push the clothing up past right to her elbow. And then I'm going to put some cream. I'm going to warm the cream in my hands first. I'm using the seated core to protect my back and my arms. And I'm just going to gently apply the cream. Okay, you can relax your hand down. There you go. You're so used to working, aren't you? You're just not used to having somebody else do it all for you, are you? So I'm just, with some light smoothing, just really applying the cream and warming her skin. Can alternate your hands. And then you, as the giver, don't get as tired. Now because she has, I'm going to demonstrate with her clothed on that side, I'm going to wipe the cream off of my hands. And then I can just do some circular strokes here, just through the clothing. Sometimes massage therapists tend to do a lot of work with our thumbs. And you can do some circular motions with your thumb. But remember, when you work with seniors, it's more about the technique than it is the pressure. You can just use some small thumb circles. It's just like a circular compression. All right, now I'm going to demonstrate how to do a hand massage. First of all, if any of their joints are swollen, just do a cream application. No massage or traction to swollen joints. For normal skin and joints, support and cradle their hand with yours to gently spread their palm. You place your thumbs on the meatiest area near the base of their thumb and the base of their pinky, and you spread their palm, working what's called medial to lateral, from the middle to the side. You always want to take care when working with the hands that their wrist is straight and flat. You don't ever hyperextend the hand in any case. Always keep it supported with the wrist straight. Then you turn the hand over, and then I just slide my hands from the wrist all the way to the nail bed and put a little gentle pressure on the nail bed. I'm not pulling the joint and doing any traction on this at all. I'm just sliding my fingers down and putting a little pressure on the nail bed. This is to reiterate that their hands begin at the wrist. And then I'm going to change hands, because that protects my hands. So when I turn her hand back over, I'm going to take this top pillowcase and wipe any excess cream off of her palm so that doesn't compromise her grip. Okay? So now I'm going to do some work on her neck and what's called the occiput, which is the back of the head here. It's where all the neck muscles attach. So my stance, I'm going to be in horse pose. in order to remind my students to pay attention to the horse pose, I'll say, now soften your knees. Behind your chair, my knees are soft. I'm going to put one hand on her forehead. My fingers are lightly curled, and I'm positioned far back enough that I'm able to move freely. And I'm just going to do some gentle, what's called circular occipital friction. I wish I could do this to myself. This is where all of the neck muscles attach here at the occiput. So when you work the attachments, you work the whole muscle. But I'm just using my fingertips. I don't have any product on my hand, and I'm holding Sigrid's forehead just to keep her head stable. The second technique, I call this C squeezes. I'm going to put my fingers on either side of her spine. Here, I'm not doing any pressure on the bones, but I just have my fingers like this on either side of her spine, and then I'm just rocking gently with my legs, and that gives the appropriate pressure on her neck. How's that pressure, Sigrid?
Great.
Good. I'm working at her side, and my body is in warrior pose. I would probably do at least 3 to 5 minutes on the neck. So after I'm finished with her neck and shoulders, I'm going to ask Sigrid to lean forward a little bit, and then I'm going to let the heat drop to her low back and lean back. So her shoulders are all nice and warmed up, and now the heat's going to be on her low back. So I'm in horse pose behind her chair. My knees are soft. I'm going to mold my hands to her shoulders, and then using appropriate pressure, I'm going to move my thumbs in a circular motion on those points that we all feel on our shoulders that need massage. Remember, you are working superficially. You are not on the bone. You're working on the muscle. This is the trapezius muscle, the large kite-shaped big muscle in your shoulders. So of course, we feel it most in our shoulders, working on the computer, driving, cooking, reading, everything we do. Our hands are in front of us and we're working all day. So I would say about 5 to 6 minutes to work on the shoulders, and even longer, but I would say 5 to 6 minutes. Of course, this is my favorite whenever I get a massage, because I always feel it in my shoulders, and that's where I need work. And so do you, Sigrid.
Mm-hmm.
How's that pressure?
Great.
Good. Just remember, you are working superficially. If you have someone that says, oh, you can go deeper if you like, then that's fine. Always listen to your client. Of course, if they have diabetes, they have a decreased sensation. So you're going to want to add caution in how deeply you go. But some seniors can take an incredible amount of pressure. You just have to constantly check in with them to make sure they're not uncomfortable and they're getting what they need. Of course, if they don't have diabetes or any other conditions that they have decreased sensation and they say, you can go deeper if you like, then you can give them a little bit more. But remember, it's more about the technique than it is the pressure. So one area as a massage therapist that I always focus on, especially with seniors, is their chest. But before beginning any massage on their chest, you first have to explain what you are doing and why. Number one, if they are wearing a pacemaker, you do not do this move because you do not put any pressure on that medical device at all. So if there is any type of a port or anything within their chest that you're not supposed to touch, then this move is not to be done. But if it is appropriate, before beginning any massage on their chest, you must first explain your intent. I'm going to say, now Sigrid, I'm going to do a gentle stretch for your chest muscles. As you see, many people begin to lean forward as they age. And this stretch will help to lengthen your chest muscles and balance your body to help your posture. So my stance is horse pose. I'm behind her chair. My knees are soft. My hands are slightly spread and angled toward her sternum. Then the base of my pinky, the meaty part of my pinky, is right here on the edge of her shoulder. Then you're going to let her clavicle or her collarbone be the guide for your thumb to either let your thumb rest above it or below it, never on the clavicle. Since she is so small and slight in through her chest, then I'm going to rest my thumb below it. And then I'm going to begin circular compression in one direction. I go usually 8 to 10 revolutions in one direction. Then I'm going to change directions. So it's really my body rocking back and forth that is creating the motion. Now, because we had that moist neck heat there, these muscles are already warmed up. So the muscles are already warmed. After I've done this circular compression, I can feel the muscles starting to lengthen. So now I am going to shift my body weight side to side, and that will help to bring her shoulders back. and help her posture. We all need this, whether we're a senior or not.
Mm-hmm.
And this technique, you would let it last about 3 to 4 minutes. The last thing I like to do after I finish the massage is, most seniors wear glasses, and so I like to keep a microfiber cloth in my pocket when I walk over to get their glasses for them to help them put them back on. Then I just give them a cleaning, because this is something that no one else does for them usually during the day, and it's a little nicety and just an extra service. So there's your demonstration of just a basic senior massage for someone in a wheelchair to work their arms and hands, neck, shoulder, and chest. If you have any questions or need any information about upcoming classes, please visit my website, seniorspa.net. Seniors rock!